Sir, is it okay to do orthopedics from a private hospital? Will I get a good hands-on training? This is a question almost every NEET PG aspirant has at some point before choosing residency in orthopedics. So let's talk about it. First, this idea that private means weak and government means strong is not true anymore. It depends entirely on the college, not the funding source, be it private or government. A private hospital, which is a genuine teaching institute, can be as good or sometimes even better than certain government setups. Now, let me explain exactly what I mean by a genuine private medical college. A good college is one where professors actually come regularly, residents are present, working, and trained properly. OPD and OT run daily with real patient load. Teaching happens consistently, and the hospital does not exist only on paper. We are not talking about those name only colleges where residents come to sign in the attendance and go home, and professors are honorary faculty who appear twice a month or just for the inspection. Let's remove those from the conversation. We are talking about real private medical colleges that are functioning teaching hospitals. Now, what makes these good private colleges worthwhile? Faculty presence and teaching quality. In many colleges, in many private colleges, the faculty includes full-time professors who come daily. On the on the top of that, many professors also have their own private practice outside the medical college. This is actually an advantage because through them you learn what happens inside a medical college and what real orthopedic practice looks like outside the campus. How cases are selected, how decisions are made, how the business and administrative side works, how follow-ups and outcomes are handled in real life. You get dual exposure, like for academics as well as private practice, which is something most government hospitals cannot offer. If your professor trusts you, they will take you to their private hospital for assisting and learning. Those cases, the ones you go for the assistance, are often cleaner, elective, more structured, great for learning principles. The second benefit is infrastructure. Most private hospitals have cleaner wards, functioning lifts, modern operation theaters, better implants in stock, updated instrumentation, and the staff that is well trained specifically for ortho surgeries or any surgeries for that matter. Especially the OTs. Many private colleges have modular setups with proper laminar flow, arthroscopy machineries, C arms, good surgical instruments that are well maintained. This makes your learning smoother and reduces the chaos. The third benefit is the living conditions. Like the private colleges generally have better hostels, rooms, bathrooms, mess, and overall living conditions. I'm not saying those are five-star things, but at least they are manageable. And when you're doing a surgical residency where sleep is precious, good living conditions are not a luxury, they are a necessity. Of course, the fees are higher, but daily life becomes less stressful. The fourth one is the patient load. The biggest misconception that where people keep saying private hospitals don't have patients. This was true maybe 15, 20 years ago, but not today. Schemes like uh, MJPJAY, PMJAY, and various other state funded programs bring massive patient inflow to private hospitals. Zata. So because for the patient, surgery becomes a cashless and heavily subsidized. So trauma and elective cases come regularly. In many private hospitals, the trauma load is very high, sometimes even more than some district hospitals. So you get exposure to fractures, dislocations, nailing, plating, external fixators, Elizaro ring fixators, LRS, spine emergencies, joint replacement surgeries, arthroscopy surgeries, all of it. You also get pediatric cases also. Well, the next thing is hands-on exposure. This is the biggest advantage. In many private setups, consultants are busy with their own private practice outside the medical college. They supervise your cases, but they don't micromanage everything in the medical college. So residents often get more autonomy inside the teaching hospital. This means first years get good reductions, K wires, wound management. The second years get good amount of cases for nailing, plating. The third years get to handle major trauma, arthroplasty as assistants, sometimes primary surgeons under supervision. The very premise of having a consultant who works outside is this, that they give you a free hand. The next thing would be real world decision. The next advantage is real world decision making. That is another underrated advantage. In private hospitals, you learn how real world decision making happens, like when to operate, when to wait, how to discuss options with patients' relatives, how to balance cost, outcome, and ethics, how to plan implants based on availability depending upon patients' income, how to manage emergencies with limited time, how to document properly to avoid medical legal issues. These skills matter just as much as surgical technique in your future life as a consultant. The seventh advantage is not an advantage, but rather I would talk about limitations. So now let's talk honestly about the limitations. A private hospital is not good when the patient load is low, professors are honorary and very rarely present, residents come only for attendance, the OT runs once a week, OPD is slow, only one or two types of surgeries are done every time. There is no proper trauma flow. Teaching is irregular. No senior residents to guide juniors. In that case, it really does not matter whether the college is government or a private. The residency will always be weak. So, so how to judge a private ortho residency? I think for the checklist, I would say look for the daily OPD numbers. Look for weekly OT, minimum 3 OT days or 2 OT days. Variety of surgeries, the number of residents versus the number of cases, the faculty presence and the teaching style. How many cases seniors actually do, how many cases juniors are allowed to do, whether the third years become independent decision makers. The infrastructure quality, maybe that must be the least thing that you should be worried about. If these are strong, then orthopedics from a private hospital is absolutely worth it. Like, to end this, I would say private or government does not matter. A good private hospital can give you excellent hands-on exposure, better infrastructure, and a more balanced residency experience. So, but you have to choose wisely. If the patient load is good, professors are present, and the OTs are running regularly, then yes, doing orthopedics from a private hospital is absolutely fine. And for many people, it becomes a great training experience. If you have any other questions, you can definitely put it out.